Assalamu alaikum. Welcome to 5th International Conference on Applied Zoology. I am Dr. Madeeha Arshad, Assistant Professor from Department of Zoology, University of Education. And the today topic of my talk is study of hepatotoxicity and nephrotoxicity induced by sodium arsenide nanoparticles in mus musculus. First of all, what is toxicology? Toxicology is the branch of science which deals with the harmful effects of chemical and physical agents on living organisms. And what are toxicants? Toxicant is a substance that can produce deleterious conditions on a living system, and they may be man-made or naturally occurring. General toxicants, what are the general toxicants which, for example, drugs, biological toxins, radiations, chemicals, heavy metals, and infections agents are the general toxicants which can induce toxicity. Here we have used arsenic as a toxicant. Arsenic is an element that naturally occur in Earth's crust and its core. Its occurrence is in soil, plants, drinking water, various foods, sediments, air. Anthropogenic procedures also contribute arsenic to the environment. If we talk about the chemical and physical properties of arsenic, it is a metalloid. It is present in the form of arsenite or arsenate +3 or +5 valency. It is having different oxidation states, three allotropic forms used for making glass, wood, and preservation. It is a lustrous silver gray and crystalline, exhibits shine or glow, poor conductor of heat and electricity, hard and brittle, and garlic odor. Advantages, if we talk about its advantages and disadvantages, its benefits are metabolism of amino acids and gene silencing, important for treatment of leukemia, important for metabolism in plants, important for elements in semiconductor technology, used as medicine for diabetes, syphilis, and asthma. And its disadvantages are liver damage and changes in myocardium, skin burning, skin cancers, lung fibrosis, anemia, enhanced carcinoma, formation of in rodents, carcinoma in rodents, respiratory illness, and tubular necrosis, also caused by arsenic. Route of exposure to the human or animals is dermal contact, inhalation via absorption through skin, and gastrointestinal ingestion. If we talk about the mechanism of mode of action, it causes DNA damage, histone methylation, produce oxidative stress, stop DNA repair mechanism, decrease hepatic glutathione, and change in configuration of DNA binding. Objective of this study was to evaluate toxicological effects of arsenic nanoparticle on liver and kidney to check alterations in the LFT and RFT parameters. Uh, Problem statement: arsenic stimulates pathological disturbances within the body. So nephrotoxicity and hepatotoxicity of arsenic nanoparticle will be analyzed in this study. Plan of work: sodium arsenide nanoparticles LD50 was 75 mg per kg used according to CM to 2008. Dose administration: total number of mice used in this experiment was 20. Control group was without any treatment. Dose group was treated with 5 mg per kg, 25 mg per kg, and 50 mg per kg of the sodium arsenide nanoparticles. In this experiment, Swiss albino mice, mus muscular, were used, and they were placed in steel cages of 8 into 14 inches. 12 hours standard light and dark conditions were given to the mouse. Humidity level were maintained at 40 to 45 degrees centigrade, and chick feed number 14 was used, and water, free excess of water, clean drinking water was given to the mouse. Our sodium arsenide salt were used in this experiment, and it was firstly it was prepared sodium arsenide nanoparticles, then it was dissolved in distilled water, and it was given for 1 month consecutively. Study duration was almost 9 months. Sample size, dose group were, there were four dose groups: control, dose 1, dose 2, and dose 3. Ethical considerations, according to UE Ethical Committee, clean water, chick feed number 14, humidity, and dissection through cervical disjunctions, surgical gloves, and laboratory preventive measures all were observed during the experiment. After 30 days, 1 day for acclimatization period was left. In 32nd day, dissection was done, and blood was collected for biochemical testing, and liver and kidney were removed for histological purposes. And histological purposes, slides were stained with hematoxin and eosin stain. For biochemical testing, RFT and LFT tests via kits were performed. SPS 21 software was used. 1 day of ANOVA was applied, and significant differences between control and dose group were considered. Results. Comparisons of LFT parameters in sodium arsenide nanoparticle treated group with control. There was a significant difference in bilirubin total, bilirubin conjugated, bilirubin unconjugated, alkaline phosphatase, and alkaline transferase. These all were parameters were differentiated, p-value less than 0.05 in all groups were observed. Comparison, if we talk about comparison of RFP parameters in sodium arsenide treated group with control, blood urea level was significantly different from the control, while serum creatinine in high dose serum creatinine was also significantly different from control group. Histopathology of liver. The section shown in the figure is from control group, which is showing normal central vein, hepatocytes, and sinusoidal spaces. While this is the dose 1 group, which also shows almost normal central vein, hepatocytes, and sinusoidal spaces. In those two, sinusoidal spaces, central vein, and hepatocyte were also observed to be normal. While in those three, some kind of vacuolation by nucleated nucleus or normal central vein was observed. Histopathology of kidney in this figure, normal or control group kidneys histological sections are presented, which shows normal glomerulus, distal tubules, proximal tubules, macula densa, and etc. If we talk about dose 1 group, it showed normal glomerulus, tubular cells, and other structures were also normal. In those two, some kind of vacuolation was observed. And in those three, glomerulosaccharidosis or tubular necrosis were observed. Conclusion. Sodium arsenide nanoparticles significantly altered blood urea, serum creatinine, and bilirubin parameters, both conjugated and unconjugated, as well as alanine transaminase and alkaline phosphatase activities. But histologically, sodium arsenide nanoparticles were not as damaging as sodium arsenide in its inorganic form. So it can be concluded that nanoparticles can cause harm at biochemical level, but not as much as detrimental as arsenic itself. Recommendations. Arsenic through water, crops, and food should be avoided because in its inorganic form, it is much deleterious, but its nanoparticle can cause harms to the biochemical parameters of the blood, but it is almost safe in organs. Organizations, agencies, institutes must spread awareness through modulate rules and regulation programs and pamphlets. Thank you for your attention.